Guest with us in the studio right now, Mr. Sanjay Advani. He is the CEO of Better Healthcare, indeed a man who knows quite a bit about the East African economy right here. Karibu sana, sir.
Thank you. Welcome.
Well, first off, the fact that you are one of the companies highlighted in the Company of Year Awards in the corporate governance segment, the fact that this award celebrates corporate citizens who have been able to carve a niche for themselves in efficiency, good use of funds, being able to relate well with the environment. Please tell us something about that and how this relates to such numbers that we are seeing here.
Yeah. I would say about Beta Healthcare, it's been here in this country since last 1947.
Yes.
And we have been there since then, and we have grown from there to what we have reached today. Yeah, we received the award. We received basically 2 awards.
Yes.
And it's all about the teamwork which resulted in getting the Koya Awards.
Mm-hmm.
Yeah.
Well, since 1947
Yes.
to today, that and the growth you have seen, that says one thing: sustainable growth, sustainable development, and consistency. Please tell us something about these values, what they mean for a corporate citizen, a company, how you have achieved this in your organization.
See, I think what's important is the governance side of it.
Yes.
We took over. This company, as I said, has been there since 1947, but from the Aspen Group perspective, we came in and took over from 2007.
Yes.
So since then, Beta has been 100% owned by the Aspen Group. Mm-hmm. Well, there are 3 main important things to run a business. I mean, one is the governance side. We in the company have a governance manager. Yes. So all the governance-related matters are handled and channeled so that everybody, each individual in the company knows exactly what he has to do and do it in the right way. Mm-hmm. The other thing which is important is the safety, health, and environment. Safety and health of the people employed in the company, mm-hmm. as well as the environment in the company, and in what way we can contribute for the country.
Yes.
The third one is the CSR activities, wherein we put in all our efforts and try to do a bit for ourselves from our end, mm-hmm. for the country and mm-hmm. for the people. Mm-hmm. So that's how it.
Okay. And let's talk a bit about the product. The fact that across the entire East Africa region, not just in Kenya, the pharmaceutical sector is dominated by what we'd call mom and pop stores. One store, no standardization. A lot of the time we have issues of fake drugs, substandard medicine, mislabeling, mis-selling. Quite a large raft of serious issues across the board. How has your company been able to literally be able to weather this sort of storm and be able to stay in this market?
It's a very good question, and one can explain it in the right way. See, basically, if you see the East African market, in Kenya, we have 38 pharmaceutical companies that are into manufacturing. Mm-hmm. If you go to Tanzania, there are only 6. Mm-hmm. If you go to Uganda, there are only 5. Mm-hmm. Basically, and there are around 300, 400 companies outside Kenya who are exporting into Kenya. Mm-hmm. Now, let's talk about Kenya. Now, counterfeit, if you really drill down, there are 38 companies, as I said, which are in Kenya. Yes. Out of those 38 companies, if you go and ask them, there is very little of counterfeit drugs that comes out of for the local companies. Yes. Most of the counterfeit happens from which is imported. Mm-hmm. Now, you know, there are a lot of things which come in. The government has to be blamed. There are no stringent laws or whatever. What are the laws are stringent, but a company sitting outside there also has a responsibility. Yes. After all, they are selling in their brands into the country, and they don't have anybody taking care of the brands. Mm-hmm. What they are only interested in is selling and exporting the brands. Mm-hmm. Here, a distributor imports it and sells it, and then pays them off. Mm-hmm. So basically, a company out there also has a responsibility in the country to ensure that the brands are protected, there are no counterfeit happening. Mm-hmm. But the companies which are manufacturing in country do not have that problem, because they have the field force, they have the staff, they have people, mm-hmm. and nobody tries to counterfeit those products. Mm-hmm. So that's the difference.
Yeah, with the so to say increase in disposable spend in this part of the world, we have started to see interest from global companies who are starting to bring in, so to say, the Boots model, where you have standardized stores across the board, maybe rather than just one chemist or pharmacy run by one person and his wife. You now have chains with 10 or 15 or 5 stores across different towns, even in places like Nairobi, at petrol stations, at convenience stores, bringing a standardized level of service, ensuring that the drugs are sourced from the same place, are of the same quality, are dispensed in the same manner. This sort of standardization creates a situation where, well, consumers can start to expect a certain level of service. How do we sort of, so to say, empower these people going forward so that this can spread across the board and create a better market for companies like yourselves?
For example, now if you speak about Beta Healthcare is part of the large Aspen Group.
Yes.
Aspen is around $2.5 billion company, which is now, I think, 6th in the world where generic medicines are concerned. And Beta Healthcare is one of the affiliates of the Aspen Group. Basically, multinationals are looking into Kenya and into East Africa. But basically, what's important is putting up a manufacturing facility. See, a company grows when there is manufacturing, there is employment. Trading is another part of it. But yes, there are chains of shops which have recently come in. And there are also pharmacies which is handled by a wife and a husband. But what is important to see is what kind of a surcharges are charged by those by those chain, and what is being charged by a pharmacy which is run by a husband and wife. After all, these are medicines.
Yes.
It needs to be made available at an affordable price.
Yes.
So what I look at is maybe there can be a shop, a pharmacy, which is run by husband and wife, but what kind of a service at what price they are selling, what kind of service they are giving. That's more important than the chain of...
Very quickly, my last question to you is the role of technology and innovation in this sector. The fact that we now have things like M-Pesa, we have seen the entry of mobile doctor services. Safaricom has pioneered things in that line together with insurance companies to underwrite costs. Where do you think this is driving the industry? Very quick.
I think technology is the key. As the technology improves more and more, it's a success for the company, for the country, for the people and everything. So it's very important. We in Beta as a company also, we have a SAP model. We invested around 1.5 million only on the ICT front. So the newer machines, the newer factories, technology plays today. That's the most important thing. Yeah.
And of course, we hasten to add that information also and technology also empowers the consumer to be able to make the correct choices and to check for, well, counterfeits and other things.
Absolutely right.
Well, thank you indeed very much, sir, Dr. Sanjay Advani, the CEO of Beta Healthcare, for taking the time to talk to us. Indeed, the fact that governance plays into so much of this economy right here in Kenya and across the world. Thank you, sir.
Thank you very much.
Well, that is where we want to bring it to a close here today on KTN Business Today. Before we go